Today on the Transplant Helper, we're going to be talking about a subject that I believe honestly has to fall into one of those gray areas, and that is the subject of non-compliance. What exactly does it mean? Is it possible I could actually be deemed as such? And if so, what are some of the consequences of being in such a category? Stay tuned. Hey folks, welcome to the Transplant Helper again today. My name is Jim Merle. This subject of non-compliant, I have to admit, yes, it is kind of a gray area. And the reason I say that is because I don't believe there are any set structured rules or bylaws by which any team and or doctor must follow. Now, believe it or not, I'm not the guy who says every team is different on everything, because that's simply not the case. As a matter of fact, there are many federal standards, if you will, not by the government, but federal or worldwide type standards that have been deemed by, for example, the National Heart Association, by UNOS, by the FDA, that sort of thing, when it comes to caring for a standard transplant patient. And those are some of the laws and bylaws through which your doctors often operate. So because of that, there are a few things that are going to be pretty much universal throughout every healthcare system and throughout every transplant center. However, when it comes to deeming a patient non-compliant, that is not the case. There are no real set standards, if you will. There are no real set rules that every single team is going to follow. And that's why sometimes it can put a little bit of apprehension, maybe even fear in our minds when we think about the potential of being marked non-compliant. Now, if we ask the question, what is non-compliance? It's exactly what it sounds like. And that is a team or a team member, one of the doctors, has marked you as being uncooperative or not willing to cooperate with whatever treatment they have laying in front of you. Now, typically that comes about when you say refuse some sort of procedure, refuse some sort of level of care, or even if you're not doing very well at managing your medications. And you know as well as I do, especially post-transplant, probably the most important thing you need to be participating in as accurately as possible is the managing of your medications, taking them on time, every time, the right way. That is so important to surviving this life. And if your doctor's deemed that you're making little or no effort at that, then obviously that's going to become a problem. Now, whether or not they'll mark you non-compliant exactly for doing that, I can't tell. Again, it's going to be up to your team and your group of doctors, but I do know that is one of the possibilities out there as far as to why they might do so. Now, I've actually personally had a couple of incidents, if you will, where I've had to deal with the threat, at least, of being deemed as non-compliant. Both of those came pre-transplant. Both of those came for different reasons, and I'll tell you a little bit about them, and you can kind of use these cases to maybe judge whatever situation you might be in. The first one came up, one of my favorite doctors. Her name is Dr. Pambukin. It was pre-transplant, maybe even about 2 years prior to my transplant. I'd already been evaluated for transplant a couple of different times, and the team had decided, along with my help in that decision, that it was not quite time to list me for transplant. However, I was pretty much on the brink of needing to be listed, and we always knew that I was probably 3-6 months out from needing that status listing, at least be listed to begin with, and probably be listed at a pretty high status, which eventually got to a 1A, the top tier of the list. But nonetheless, here I am. I'm sitting in my doctor's office. They're kind of telling me about how they're about to start the evaluation process again, how they're going to get the ball rolling, and then likely on this third time, they thought that I would need to be listed. And the doctors were asking me, particularly Dr. Pambukin, she asked me, she said, "Mr. Merle, how much are you walking?" And I said, "Well, I walk a lot." She said, "Well, how much do you exercise every day?" I said, "Well, you know what, I stay busy." And we went back and forth about that for a few minutes. And finally, she said, "No, I want to know exactly what distances you're walking, how much you're exercising, how many miles, how many steps, how many whatever are you taking every single day. I want to know about your exercise program." And I couldn't really give an answer to that. Again, my answer kept being something to the effect of, "Well, I stay busy," or "I walk enough," and that sort of thing. And with that, she sternly stopped what she was doing. The facial expression changed. She looked me straight in the eye and she said, "Mr. Merle, they're going to mark you right now as being non-compliant until you go through 12 weeks of cardiac rehab." I've told that story before, but that's what she did, and she was serious. I mean, she sent me off to cardiac rehab for 12 weeks. I didn't see the doctors, even though this was one of those periods of time in my life when I was probably going at least every other week. But for 12 weeks, I didn't see them. She watched, made sure that I was going to be compliant as far as exercising and setting up an exercise program as I did in cardiac rehab. And I even came back with a phone app in hand, ready to prove every step I'd taken and how cooperative I had been. But that was one of those moments when the word non-compliant came out. It kind of loudly rang in my ears, and it kind of came home as far as the fact that, yes, I have to do exactly what my team says. Now, fast forward in that, maybe about 2 years, I'm guessing at the time frame. But fast forward in that, about 2 years, I'd actually been listed. It actually took 4 times of evaluating me to decide to list me, but they had listed me. I was marked as a status 1B at the time. I'd been at home taking IV medicines, Milrinone and stuff like that for about a 10-month period. Things were not going that well, but I thought I was doing pretty decent. As a matter of fact, I went in the clinic that morning fully expecting to go into clinic, get my checkup, and then my family and I were going to be leaving, going out of town on vacation to visit some friends, that sort of thing. And we were really excited about kind of getting this clinic visit over with, getting out the door and down the road. That's what our hope was. But basically, I go in that morning. I think I drove myself in. Maybe I was by myself that day, but I go in that morning to get checked up while my wife and kids were back home packing. I go to get checked up. Dr. Pambukin, same doctor, and I love her, don't get me wrong, but she comes back in the room. She begins to talk to me. She begins to review some of the numbers she's seen, some of the things that she's seen change, surprisingly, what I didn't know, very quickly over a short amount of time. And she said, Mr. Merle, we're going to have to put you in the hospital today. And I said, what? Wait a minute. Hold up. What are you talking about? She went on to explain to me that it was time. The time had finally come. I'd been listed as a status 1B at that point for 200 and some odd days. The time had finally come when she knew it was going to be necessary to put me in the hospital in order that I might be raised to a status 1 listing, as well as, potentially, as I finally did, to get my heart. And immediately I said to that, no, Dr. Pambukin, you can't do that. Not today. I've got plans. I've got somewhere to be. We're leaving to go out of town here in a few hours. Just let me go. I'll be fine. I feel fine. And she's continued to come back to me saying, Mr. Merle, your numbers aren't matching what we want. Here's where the problem is. She explained all of that. And I kept just backpedaling and kind of fighting her a little bit, kind of pushing back, begging her not to be put in the hospital and eventually, not to have to go through that, at least not that day. Now, what she turned and did, she walked out of the room for a moment. I think she was probably trying to be patient with me, but she walked out of the room for a moment. She came back in the room and she said, Mr. Merle, if you would like to leave today, if you want to go home, you want to go on vacation, you want to do whatever you want to do, you can do that. But when you do that, please know, when you walk out of these doors today of this clinic, I'm going to mark you as non-compliant. I'm going to put you as a status 7, which is basically to take you off the list. It's an inactive listing. No calls could come in. No potentials for transplant. I'm going to mark you non-compliant, put you as a status 7, and you go have a good time. Come see me when you get back. And I was like, wow, wait just a minute. I didn't like hearing that. Again, that scared me to death, because what's the potential if my doctor looks me in the eye and says I'm non-compliant? I can't do that. But me, out of my ignorance, I actually called my wife and asked her what I should do. Of course, you know what her answer was. Long story short, within a few hours, I was in the hospital. I laid in the hospital for 32 days while they upped my Milrinone, raised me to a status 1A, and eventually got the heart. And that's my transplant anniversary. This being going on this past week, 5 years ago. So that story's kind of in the books. But nonetheless, another situation where I personally, the transplant helper, heard the words non-compliant. And again, I don't exactly know what that is. I don't know, what guidelines, if any, she would have had for doing that. But basically, she was able to say on both occasions that we have a patient here, Jim Merle, as you know me, but we have a patient here who is saying he's not going to take our advice. He's not going to follow our care, or he's not going to follow our plan that is leading him to transplant. So I think in the end of that, like it or not, I probably deserve what she was saying, and I'm just thankful that I was smart enough or cooperative enough to go ahead and not let that happen. And ever since transplant, I've probably been Mr. Compliance, okay? And I'm the guy who, by the way, I preach every day. I cry out every day to every one of you as transplant patients, especially post-transplant patients, to always be compliant, whatever that is. You know, if your doctor tells you not to eat grapefruit, don't eat grapefruit. If they tell you not to eat sushi, don't eat sushi. If they tell you not to swim in a creek, don't swim in the creek. I mean, on and on the list goes. We just have to do what the doctors say. Now, will we always agree with that? Probably not. Will we always enjoy that? Likely not. Will it always be exactly what we want to do? I doubt it. But at the end of the day, we need to be compliant. You say, well, Jim, you know, I understand your stories pre-transplant, that there was a potential that you not be listed or taken off a list and all of that. But, you know, I'm post-transplant. What can a doctor really do to me? Well, the answer to that is probably not a lot. In all honesty, I suppose unless you were completely bucking the system where they might really get upset and drop you as a patient, there's probably not a lot they can actually do. But keep in mind that there are many of us, not all, but there are many of us eventually one day, if we just accept the law of averages and statistics, we may need a second transplant. And what we're going to need at that point, if that, heaven forbid, potential ever come, we're going to need a team that can look at us and can bank on us and can say, you know what, if Mr. Merle, or you fill in your name, if Mr. Merle needs a second transplant, we have a history on him. We have proof that he can handle this situation, and he's going to give it his best chance. Now, that may be what we need one day. Again, not necessarily what we want, but that may be what we need. So what's the point of all of this? The point of all of this is just to remind you to please don't spend a lot of time questioning your teams. Don't spend a lot of time trying to find a way around some of the rules, if you will. Just do what your team is asking you. Do your best. And, you know, use your judgment sometimes, but do your best in every situation. Because certainly if we're post-transplant patients, we have so much that we're blessed with. So what are a few things we can't do versus all the wonderful things we now can do as a result? If this program has helped you out in any way as far as understanding noncompliance, maybe not totally understanding, but at least thinking it through, I bet go ahead and give me a big thumbs up on this program. Those likes certainly encourage me. They encourage me to continue to provide you with content, which I hope is set up to advocate, educate, and motivate you as a transplant patient. Let me encourage you also, if you've got any stories of noncompliant that you'd like to share with the Transplant Helper community, go ahead and comment below with that. That's not only going to help me to understand that better, but especially your peers, your fellow transplant patients, to understand that better. Maybe there's some things we could talk out and we could discuss there. That community is a wealth of information listed beneath these videos in that discussion. But nonetheless, I do hope this has helped you out. If it has, please go ahead and like it, share it out with your friends, anyone who might benefit from it, as well as the fact I remind you again to please subscribe. I also want to add to that a lot of times here on the side of this screen, right up in here, you'll find several videos, not necessarily always mine, but several videos that might even be along the same lines, but they're all intended, provided by this channel to try to help you to live the best life. With that said, I appreciate you joining me today. Until next time, please stay stronger, friends.